please. Thank you.
Okay, so aloha, everybody. We are really happy to be here. We want to thank Naomi and everybody at the district for supporting this topic. This is can be a difficult topic for people to talk about, and we just want to prepare you also because we will be discussing the topic of suicide, which can be a difficult topic, so we want to make sure that you each take good care of yourselves during this presentation. But a big shout out and mahalo to Rotary for acknowledging that mental health is an issue and acknowledging that mental health is worthy of a training session like this. So thank you to each of you for taking the time today to be with us. So we thought that Kelly and I believe that we should not only present some issues, but we're really hoping to get into some dialogue with you, which is going to be challenging in our time frame, and then of course challenging under these circumstances. But our style really is to have some dialogue, but we do have some slides that will help provide for that. So moving to the next slide, again, I'm Kathleen Merriam, and we would be happy to share these slides if you would like to put your email in the chat box. Then we can get this out to you, this PowerPoint presentation. Just a little bit about myself, and then I'll turn it over to Kelly. So I've been working in mental health for over 35 years. So professionally, I have a license. I'm a clinical social worker and a substance abuse counselor. And I oversee the Windward Mental Health Center. I've been with the Adult Mental Health Division for 17 years here, but in a variety of different roles. And I became a Rotarian when I moved to Hawaii, and it's been just the best partnership that I could possibly imagine. My partner here is Kelly McDonald, and I'm super excited to, if you haven't met him, Kelly, why don't you say a little bit about what you do in terms of mental health?
Well, I'm lucky enough, I've been involved with Rotary since 2011 when I was invited by a school superintendent to join when I was helping run their election and campaign committee in Washington State a number of years ago. Moving here to Hawaii to work with Aloha Care, who's the state's only nonprofit managed care organization working in Medicaid, Medicare, behavioral health, accountability around, our members' whole well-being, which includes, for many of our members, a lot of attention around mental health, behavioral health needs. This is a topic I live every day. So I am seeing a bunch of folks populating emails in the chat box. Thank you so much. I will make sure to capture all of those emails. I'll just do a download of the chat before we close the session today. So we'll ship off the slides, which have some resources that you'll see coming up, as well as any other questions or topics that emanate from that chat session if folks post other resources or ideas. Again, our goal is to have a facilitated conversation, share with you some high-level information, but really, I heard some great things from Robert Jackson's session on vocational last time about some of the things other clubs are doing, and really that's the best part of this training, is to get to learn and share. So thank you so much, Kathleen and Naomi, for the invitation.
Thank you. So that's about us. Kelly, do you want to start off with some trends that we're going to focus on?
Sure. So, this is, for me, one of our greatest challenges working, in the healthcare field is that, Hawaii, our second, being the state, not quite the nation's leader, but the second highest leader in per capita suicide per 100,000. This is one of the leading causes of preventable death here in Hawaii. During the same period that the Commonwealth Fund did this study, alcohol and drug-related fatalities also ensued. And of course, this is kind of a vicious cycle, the way mental health works with substance abuse and our lack of both access to mental health services and substance recovery service as well, which you see in kind of the second column, which is, gives us a picture, a snapshot of where we are in Hawaii. We have a high degree of acuity and need. We have a low level of access to service providers to help. And now we layer onto that normal, the COVID, and our current crisis where we are more isolated, less connected, under greater economic frictions and stress, under greater interpersonal stresses. So I think for both Kathleen and I, our kind of takeaway is, mental health is an us, not a them problem. This isn't about the person that we see on the street that's the obvious visible manifestation of the seriously mentally ill in our community, but it is about something for our own self-care, the care of our members in our club and our community. So thank you.
Excellent. Thank you, Kelly. And what I liked about Naomi's invitation regarding this topic is you've been very clear about what's going on with our members. How are our members doing, and how do we take care of our own mental health? And then also, what about our community? We are very concerned about our community's mental health. So Rotary, if you haven't been a part of this, Rotary is probably more active now in many ways than before. There's a lot of Rotarians that are currently serving those in need. And as you know, by volunteering, it certainly helps ourselves. So I think Rotary is making a huge impact on mental health, improving mental health. As you know, May is Mental Health Month, and we have a little video for you.
Let me just click onto this real quick. Is the video showing up?
Every year, millions of Americans are exposed.
Was the video popping over? Do I need, okay, I don't know if I need to change the share, okay.
Contagious virus.
It's not a disease.
But it's toxic.
It's not genetic.
But we're all at risk. You can contract it from a stranger or a friend.
You can catch it at the movies or by listening to a song.
And if you spend even a minute on the internet,
You've definitely been exposed.
What is this virus? It's stigma.
Stigma.
It's stigma.
stigma may not directly affect you.
But it harms the 1 in 5 Americans living with mental health conditions.
Stigma promotes an environment of shame,
Fear and silence.
which prevents millions of people from seeking help.
Stigma isn't just harmful.
You also risk coming across as a real jerk.
But there's good news.
The National Alliance on Mental Illness believes stigma towards mental illness is 100% curable.
And it's pretty easy to find out if you have it.
So do yourself and everyone a favor.
Go to curestigma.org and get tested for stigma.
Sorry about that. She didn't actually move, but we could hear it. So the words are powerful for sure about stigma or discrimination that people with mental illness or a mental health condition face every day. NAMI, we'll talk about them in a minute because that can be a resource for those of you that might have a loved one that has been diagnosed, or they also have just simple fact sheets for the lay person. You don't have to be a psychiatrist to try to, just simply be involved and be helpful and get more tips on how to help somebody. Okay.
So when Kathleen and I were talking in preparation for today's session, the things that both from her perspective, for me as somebody who's non-clinical, but who works to support our members, the things that we're doing in terms of outreach, as non-clinicians working with our members, connecting them obviously with clinicians where appropriate, but engaging in a series of kind of probing questions with a number of our members, in our Medicare and Medicaid health plan to kind of ask how they're doing. What is the kind of level set that they have? And kind of these questions on the one side for where care begins at home, and then for how we extend that conversation. And the other side about, what can people do if they start to see and start to vocalize concerns about becoming more sedentary? That their self-isolation has reduced their habits of exercise. What can we do to help support them for walking, stretching, movement that's safe and can be done in place? Gyms are still closed in the state. We live in my wife and I live in a high rise in Waikiki. Our gym, our pool, our exercise space here is closed off. So fortunately, I get to walk my dog every day. Do we find, we know from, there was a recent article in the Atlantic Monthly that alcohol purchases across the country have gone up about 52% in a year-over-year average. So we know part of the way people are coping with the uncertainty and the stress of COVID is to smoke and drink more, which aren't necessarily effective coping mechanisms, are going to further disrupt their sleep, going to further exacerbate anxieties and depressions. So how can we militate against that? Add water. It's amazing. You know, H2O, it's both purge the toxins, keep you feeling full, make you less prone. You don't need a mask to prevent yourself from snacking if you just drink water. You know, how are people's sleep patterns being changed? You know, part of our ability to cope, you know, is disrupted when our sleep is disrupted. The things that maybe our normal routine stressors become exacerbated, more difficult to resolve when we are less mentally reinvigorated at the beginning of each day. So figuring out what do we need to do to shut down our minds, worry less. You know, I love NPR, but I live a very short distance from work, but I now listen to music on my little drive to work because I couldn't stand, the moment I got on, there was a COVID death toll, and they would update it before I even got to my office, which is less than 3 miles away. And that was for me personally more anxiety inducing than I was prepared to deal with. I don't need to know a real-time death count around the world, you know, in 10 minutes to know that we're in a very serious situation. You know, where have our connections been, you know, broken? You know, for many of us who, if we're working, you know, and all of our teammates or our comrades are now working remotely from home and we're only connecting virtually, how do we find a way to re-intentionally connect? You know, doing that, you know, in clear, thoughtful ways, you know, to rebuild some of that social stickiness that is lacking when we are physically distant. You know, we need to stay socially connected, just, you know, stay close. And then think about what are our routines and how do we create boundaries? You know, for folks working from home, this work-life bound mix that, you know, is talked about in the literature has been completely eroded. You know, I don't have an office, a home office in my little apartment. It's the corner of the living room, you know, and on the other side of the living room is the kitchen where I cook and where I eat. You know, so these distinctions where we used to go outside of our home to do one part of our life and come back home for that distance has been eroded, and that becomes difficult. We may be working more. We may be feeling the stress of work longer. We've now have made ourselves more accessible. And so some of those distinctions, you know, erode some of our comfort, some of our resiliency from a mental health perspective and our ability to cope both with the stressors at home and at work. So just being sensitive to those and thinking about the changes and what the kind of corollaries are that we can, you know, adapt to and make is the type of conversations we're structuring, you know, with our members at Aloha Care. So please, if anybody has questions, comments, observations as we go, please, you know, unmute yourself or, you know, add to the chat. So, you know, in terms of other resources, in terms of getting needed care, I mean, part of the next conversation, you know, again, as a non-clinician, I'm not in the business of, like Kathleen, of doing direct patient care. But my goal is to connect our members, my staff, my employees with my company to resources we have to help them work. You know, mental health services are increasingly covered by, you know, health insurances. There may be co-pays or, you know, there may be, you know, small costs connected to them. People should, you know, if you haven't looked at your health insurance declaration page lately, now might be a good time to do it. Know what is covered and what is not a covered benefit. You know, if your employer may offer what's called an EAP or an employee assistance program. Work-Life Hawaii offers to many of the state's largest employers and even many smaller employers, you know, very affordable and accessible packages for employees to get complimentary counseling services for themselves as well as their family. The state of Hawaii, both for youth as well as adults, you know, has a pretty comprehensive mental health benefit incorporated with our Medicaid program here in the state. And I think one of the, you know, the biggest things that COVID has done for health delivery systems in the state is really accelerate a national trend which Hawaii was lagging in around telehealth. So, you know, because people may be immunocompromised or have other reasons to not, or providers' offices may be closed off to doing face-to-face appointments, many health systems and individual practitioners are going a long way to open up telehealth options because of changing rules with the state and the federal governments that have made telehealth, you know, a way to start a therapeutic relationship without having to have an in-person face-to-face office visit. You know, and both for our community, you know, as you know, the statewide resources with the Aloha United Way's 211 and the state crisis, you know, adult mental health crisis line, you know, are key resources for folks who have acute need with a crisis line that may be, you know, in imminent risk of self-harm or harm of others, or if, you know, as their resiliency of their economic or other social determinants, you know, fall down, Aloha United Way has great resources and has a great line of sight, you know, across all islands. And I found working with them to be fantastic. If you call and say, I need to know where the food basket is picking up in Molokai, and you're on your phone, you don't have a piece of paper to write, they'll just text you the information. They'll get it to you in the best way that you can get it to make it actionable and usable to you. So a terrific resource. So kind of the kind of, Kathleen and I have two kind of overarching questions. We wanted really to kind of start the dialogue with the folks here today. You know, so as, you know, a Rotarian and a leader in District 5000, mental health, you know, is a highly topical consideration given where we're at in the COVID. So the kind of question to the group, and again, I think we can add, you know, additional conversation in both the chat and then in the conversation here. I am getting a note that my screen may have frozen. Are the slides not advancing?
Yeah, we're on the discussion part. What are you doing to monitor your own mental health? So we could get some ideas from folks because we did want to kind of get to what people are doing because this is such an important time to focus on our mental health. Do you all want to just share a few ideas?
I could jump in and just say I'm doing a lot of, so I'm a licensed mental health clinician, 45 years in the field. Kathleen and I know each other.
Yes,
I've been offering or been asked to through different nonprofits, Alzheimer's Association and others, been doing a lot of, quite a few actually, coping skills kind of stuff for folks. I have one coming up on May 22nd. I don't want to sell myself. If you're interested, let me know and I'll send you the information. But so I've been doing, so I think what's happened for me is, and I'm in a lot of different nonprofits, Hawaii Meals on Wheels and 3 boards. I found myself to be even more active during this time, which is just zooming everywhere. We're delivering meals. I'm helping Hawaii Meals on Wheels because I am mental health. I did a lot of crisis work, helping around just how to structure things. I've been a crisis worker most of my life. And so what's happened as we've gone into this, this unprecedented time is my world, as well as everyone's world, has taken on a whole new life. And I think what I've learned through the years is to roll with it. You know, doors open and I go in there. Us as Rotarians and our service above self kind of philosophy in life, we're perfect for this kind of situation. I'm not saying it's not stressful, but I am saying that because we offer so much to other people, it does help us get through this process in a way that's different than maybe folks that have no other resources. So that's what I'm doing. So the coping skill stuff seems to be the focus right now, and that's a lot of what I've been offering out there. And anybody's welcome. It's free to the public. And like I said, if you want, just put it in the message, and I'll give you the rest of that information.
Thank you, Rick. So it sounds like being a Rotarian is actually a coping skill. Yeah, that's great.
I think we could sell that.
Hey, Kathleen, John Ozitz has a question about.
Sure.
Rotary Club of Honolulu Bay. We had a speaker on Thursday at our club, covered a lot of the mental health associated issues that are coming up as a result of the current pandemic, right? Her name was Mary Berg, and she was from the Rotary Club of Johnstown, Pennsylvania.
Okay.
And she discussed some of the coping methods or she shared with us some of the coping methods that she uses because she was a psychologist. And I will put one of them was a therapy called bilateral sound. And apparently it's on YouTube, and it's produced by a person named David Grand. And these are about 6-minute videos that that do some audio therapy to help with anger and anxiety and things like that. I'll post what I know on the chat, and if the gentleman who spoke before us could do the same, it would be really nice to get a compilation of some of these different self-help things that we can visit and share with others.
Great. Thank you, John.
Yeah.
That's awesome. There is somebody writing about suicide is giving the COVID, I didn't click on it, is giving the COVID doubters fuel for their arguments. I wonder if we are giving that issue any attention. Yeah, well, the suicide rate is going up. We're going to talk about that, and we can jump into that now.
Can I respond to that?
Sure.
Well, the dimension that I'm looking at is, and this is David Dinner from Honolulu Bay.
Yep. Hi, David.
Many of the people who are trying to stop the staying at home and things and social distancing and wearing masks are using the suicides. We've had 4 suicides on Kauai in a week, and that definitely is a problem to us, and it's an issue. But projecting the blame onto into the situation that if we hadn't stayed in place and worn masks, then we wouldn't have these suicides, I think is a bit of an oversimplification. I know the issue is there and it needs attention, but on the other hand, if we were surrounded by death and illness, we might even have more suicides. So there's that issue to look at in balancing out this conversation. That's all I'm pointing at.
Yeah, good point, David. And actually, Kauai, you all are very strong in your suicide prevention efforts. Your police department, you have a task force that's very active. And actually, the neighbor islands, to be honest, have stronger task forces than Oahu. And so I think in the suicide prevention arena, people are very cautious in saying what causes a suicide. There is no one cause, but it is an interesting factor. The social isolation, the stressors of COVID. I mean, all of these things that many people are going through. People are describing this to be an incredibly difficult time. The economics of it, the child care, I mean, we can go on and on. So it is very good, really, to be alert and aware of our friends' behavior and our own behavior, and just to kind of be more aware. But thank you, David. That's great feedback. So thanks for sharing those in the chat. Yeah, Kelly.
All right. Oop. So the kind of second primer question that we wanted to put out to folks is, our resilience both begins at home for us as individuals, us as club leaders, but kind of understanding this background, local context, knowing the landscape of our own communities. I think as Kathleen and I talked about, if we're not doing this now, we need to start immediately. And that there is some prescience to this about, what can our clubs start doing now to connect with organizations who are serving our community? And whether that's to bring in, at a very basic level, speaker resources to our club to help, disseminate information, help people be connected, for us to then, be able to bubble back up what resources or organizations can utilize the talents, the treasure, the skills of Rotary. So our kind of question to the group is, what are the things that your clubs are doing now, and where do you need additional help, to help connect with organizations in your community to get a running start on mental health for the rest of 2020 going forward?
So I could jump in again. So I'm chairing a Kapuna group because I do ages 2 to 102 is what I always say. I'm also the chair this year, I guess, for RILA. So under our Kapuna committee, we started this year a Gift of Sound. Maybe you've seen this Gift of Sound program where we're giving hearing aids away. We've been slowed down considerably by the COVID situation, but we actually just gave away a hearing aid. So folks that qualify can do that. That's one thing that we're doing. We've also brought in speakers to speak about various things that are going on around the community, right? So the Kapuna issues also, but all the other things as well. Naomi and I have also talked about, I can also offer more specific training around actual coping skills. And again, you can join the one I'm doing, but I could bring that to the Rotary as well, which just breaks it down into just very simple, understandable steps of ways we take care of ourselves in this situation. And I could team with Kathleen or Kelly around that kind of thing as well. So just, I think with the COVID thing, it's just opening it up. We're also doing some pretty fun pauhanas. And I've seen some other groups, the drag bingo thing that was going on and things like that. I mean, a lot of that is our coping skills. I mean, just doing some fun things and breaking it up. We did a happy hour, and we're going to do another one coming up. The Club of Honolulu folks are invited to join that as well. I think we have a lot of cool things going on. It's just getting the information out to everybody so folks that want you can join in. Mental health wise, we could always build on that. I think, you know, I'm just going to say, I'll start with where Kathleen started. There is some stigma issue with it within our own group. There's only 42 people on this. This is the kind of topic that I would think you'd have a couple hundred people. But the stigma thing, I would just say stigma is actually people projecting themselves onto someone that's different and trying to understand it, and it gets in the way of what actually is happening. And we always say in mental health, Kathleen, if folks treated mental health like they did a cold or a virus, you know, well, maybe not, maybe virus is a bad example today because folks are reacting to that. But if we treated it as the same, which, you know, in a lot of ways is, it's just a chronic situation, we'd have a whole different thing going on here. And I would say one last thing, professionals, the upper level, so I'm a master's level licensed mental health clinician. The upper level profession of mental health and social work is the lowest paid profession in America. If we could move past that, I think we'd have a lot more services. It's very hard to keep the funding. I was 30 years at Seattle Mental Health in Seattle. So Kelly, I was there for a long time in Washington. We actually had one point, we were almost ready to get a bump in salary for our mental health workers. Teachers went on strike and the money went for the teachers. Teachers have the parents captive. Mental health lost out. There was, I don't know if you remember 601, it forbid any tax increase unless it was voted on. And of course they always vote no. And so mental health ended up losing nonstop. We lobbied for 9 years. Well, I guess legally we can't lobby, but we worked for 9 years and we finally got a 1/10 of a cent sales tax that went to recovery kind of programs to get folks out of jails, because jail became where most mental health went after we deinstitutionalized. So getting more awareness, I think, is what we could do in the Rotary than what we already are doing. And I'll stop.
Great, thank you, thank you. I love the idea of recognizing that how this is our issue. So 1 in 5 of us, if you don't have some sort of mental health issue right now, we are going to in the next year. It's our issue. So mental health is everybody's issue. So we got to keep saying that. Dick, did you have something before we move on?
Just a comment, and of course I'm probably the original eternal optimist. Glass is always half full guy. I seldom have a bad day. I think, however, that one of the things, all of the things we've discussed are very, very important. And we tend as Rotarians to think of how we serve the larger community. Focusing a little bit more closely, all of us in clubs have friends in those clubs and other friends. And this is the time to stay in touch. This is a time when we're all attending Zoom meetings. If someone's gone silent, this is the time for us to reach out and see how they're doing. That human contact, one-on-one, for people that they know and respect can be very, very valuable at this point. We all crave that.
Great point. So one way to take care of mental health is to go through your membership list and simply call each member or do a phone tree and check in with each person if you haven't seen them. So we're on Zoom. That means we know how to do this, but there's a whole lot of members that maybe don't know how or haven't reached out. So yes, we have to take care of our members. Now,
Kathleen?
Yes.
Hey, this is Bridget Bongard. I'm
Hi.
a physician and I do integrative medicine, and I'm the medical director of the Maui Cancer Wellness Retreats.
Wonderful.
And this COVID has been a double punch for cancer patients.
Yes.
So seeing that we're having to go online, we developed a share and care program so that people could actually call in on a Zoom every Thursday and talk with two cancer warriors or cancer survivors. And maybe we could do something like that for Rotary. I love that idea. The other thing that we're doing is to develop a how do you want to recreate your life and transform it series, including self-hypnosis. And also we have aromatherapy, we have anxiety, methods to help treat anxiety and depression, your self-image, that, you know, relationships, your physical self, like was referred to with water and good nutrition. So I would be happy to share any of that knowledge with any other organization, and or if you have cancer survivors who would need our services, it's free. All they have to do is go on our website, www.mauicancerwellnessretreats.org. But this is a real passion of mine, is to heal and help people be resilient and hardy. And I'm willing to speak. I'm willing to help in any way to make that happen.
Wonderful. Please put that in the chat, because we are really getting some great speaker ideas and resources in the chat.
Okay.
A wellness retreat. Wouldn't it be fun if we could all just go on a wellness retreat later today?
Yeah.
We'll be mentally healthier.
We are.
Actually, I looked at doing one for the entire Hawaiian Islands, calling it the Hawaiian Cancer Wellness Retreat. So that's something I'm very passionate about, and I think it's something that's really needed.
Great, great, thank you.
You're welcome.
John, and then I'm just going to finish the slide. Yep.
I just have one real quick question, and it has to do with the alarming suicide rate in our state. Is there one single underlying cause that we are aware of?
No.
Okay.
No. And if you haven't met Gina Kalukakakui from Life Bridges on your island, I do hope you hook up with her. And she works with the suicide prevention walks also on your island. And Rotary Club there has helped. And that's another good example of just finding the local organization that deals with suicide prevention or mental health and finding a way to actively help that nonprofit.
Yeah, I think we've had speakers that are all have to deal with mental health and suicide at our club over the past, several years. We have not had Life's Bridges. That's a great contact. Thank you.
Okay.
It should be noted that suicide rates were up even before we went into COVID-19.
Yeah.
So it's been an issue prior to this. This just further exasperates it.
Yes.
If you will.
Yes, that's true. So this is the far end. We're talking about mental health conditions where we're just every day taking care of our mental health, focusing on breathing, focusing on problem solving every day. This is the far end of somebody really talking about possibly ending their life. So this could be a whole workshop. This could be, people get trained in this for days at a time. This is not meant to minimize the importance. I just wanted to show you this slide that you could have available to you. The most important thing on here is the American Foundation for Suicide Prevention. They are a great resource. They have a whole section on COVID-19 resources, but I like this slide because it really focuses on that there's a behavioral change. We want to be alert to how people are talking. We want to be alert to the mood of people and the actual behavior. And so in here, I'm not sure how well you can see it, but again, you'll get a copy of this, but it really, it focuses us to be very alert and aware of the people around us. And then you can turn that on yourself. I'm looking at myself saying, what am I talking about? Has my mood changed? Behaviors are things like change in eating, change in sleeping, change in drastic behaviors. So this is meant to kind of arm you with a good resource as you think about people that you have a hunch that could be slipping into depression or their mental health is really declining. But AFSP, you can find all kinds of resources on there. And I'm sorry that we are so short of time because it's worthy of much more.
Oh, I just want to give a quick plug for AFSP. Our club had them as a speaker. Our organization brought them in to do some training for managers. And as part of our club sponsorship, I walked in their walk at Magic Island, and wearing their Out of Darkness t-shirt has, when I'm walking my dog in Waikiki, has provoked, I can't tell you how many conversations with complete and utter strangers, many of them visitors to Hawaii who are at the crosswalk with me waiting to cross, and who shared the stories of someone in their family who killed themselves or who attempted to kill themselves. And just wearing that shirt in public to present to them that I'm aware of and presumably open to have this conversation, the sharing that people did was incredibly impactful to me, and the organization and the work that they do is incredible.
Well, and your agency is a great sponsor. This is one of their shirts too. Now, things like that, you also might have some extra time where you could lend that organization. They struggle. We're talking about most of these nonprofits we're going to mention are like one-woman shows, so they could use maybe 5 hours about bookkeeping, or a board, some help with their board, which is probably 3 people. It's not unlike Rotary, a struggling Rotary club. So if you had any time or interest, that's one way a Rotary club could help them. Go ahead.
I was just going to kind of skip our 10 steps slide in conjunction with the resources, so Kathleen could review some of those at a real high level. But again, this will all be here for everybody. I just want to respect everyone's time.
Okay, but definitely please check back with that previous slide, because that's a really helpful one. So check in with that. Like, we need to drink less. I say we because I've been drinking more during this period of time. So if you go to so just be sure to get that and look at that, because it will be helpful. But jumping forward to the resources, because I know we're close. So AFSP, we already mentioned, and again, the national chapter is very strong. The local one's struggling, but they do have these walks that you could help with. United Way has already been mentioned. 211 is incredible. Care Hawaii, these are local organizations. The crisis line. So if you're wondering how, say you have a situation in your home and you're just not sure how to handle it, this is when things get really bad, right? Obviously, we all know that we can call the police for assistance, but if you needed a mental health professional on site in a crisis situation, we do have something that the Adult Mental Health Division calls, it's a crisis mobile outreach team that would come out. And so that you don't have to deal with that yourself, because you know that somebody's possibly psychotic, or they really have had what a quote breakdown. You could always have somebody assist. So that's the 832-3100 number, and there's a Neighbor Island number listed there as well. NAMI Hawaii, I probably reference that every week, because I might be dealing with a family member that just doesn't understand a diagnosis and has a lot of whatever their issues are. I can go on NAMI, and there's fact sheets, there's very helpful resources. And again, a whole COVID-19 spread. On the right-hand side, this is something that's from the Department of Health. I mention this because you too could be overwhelmed. I get completely overwhelmed by all the websites, all the resources, all the TV. Which one should I zoom in on, right? And you have to decide that for yourself. You have to limit and have some boundaries around what stimulation are you going to get so that you don't get overwhelmed. This one, bhhsurge.hawaii, I think it's a good one. It's user-friendly. It's tied in with our governor and our mayor, things that are kind of government related too, so that you can keep updated that way. Lastly, I would just want to mention Mental Health America. It's a national organization, but of course we have local affiliates, and it's just a great again, I'm on that website probably weekly too, just to be helpful to other people. So I feel like I'm speaking really quickly. I'm sorry about that. Lots of material, but I know you also in the audience, as I'm looking at you, you also have great experience, and hopefully we'll continue to learn from each other. Kelly, how was that?
That's great.
Right.
I just, our emails will be included for folks for follow-up. But again, before Naomi closes this Zoom meeting down, I'll snag the chat. We'll get the notes and ideas sent out to folks. Any final observations, comments, questions, next steps? Naomi?
Kelly, Kelly, Kathleen, you guys, we're the last group, so you guys can go on another half an hour if you want to, because I think we have a lot of good resources on this Zoom. So Lynn Goya, she's a psychologist in Mililani, and she might want to share some things. Carol Reynolds works with these clients all the time, so we can keep on going.
Well, maybe we should at least wrap it up for those that want to leave, and then we could carry on. Oh, I am getting from Rick Villalobos, he wants to share slide 10. Or not, I'm sorry, not slide 10, but the 10.
Oh, yep.
Yeah. Kelly, do you want me to you want to share?
So one of the fun things that I played with my staff, and I've got 26 staff across all the islands that work remotely 100% now. And, you know, we were optimistic at the beginning, and I said, if we're only in this for 30 days, you know, you're gonna have some new time. You're not gonna be commuting into work. Use that to create a new habit. You know, there was a great TED talk about, you know, what can you do in 30 days, kind of taking off that Morgan Spurlock guy's, you know, McDonald's hamburger diet. So really thinking about what do you want to do, and, you know, doing things with intentionality. I mean, I'm kind of a big fan of Dave Ramsey from a financial investment perspective. You know, make your money work for you and it'll start working. You know, the same is true with your time. You know, and I think, again, as these boundaries erode from the private to the public to work and home, you know, where do we invest our time in a way that gives us a meaningful return, whether it's the Zooms we're involved with Rotary, service projects, how we're reaching out to friends and family who are afar, you know, but doing that work and recognizing that as an investment, and then rewarding ourselves. I mean, I know it's a little harder right now. I think there was some great kind of meditation. You know, John Kabat-Zinn is a guy that does guided meditation I love. And I use that as its own reward. But I'm also telling myself, you know, if I can keep my weight loss down, if I can increase my physical activity this year, I'm going to reward myself. You know, I'm going to go play a round of golf at Colina. I'm going to splurge, you know, play a little nicer private course rather than just, you know, playing Alawai. You know, I want to incent myself to do the kinds of things that I enjoy, that I get satisfaction out of, and that I make that part of a scheduling routine. That as I make that time intentional, do it with purpose, you know, it gives me a sense of accomplishment in a period of time when it's harder to track, you know, when the days and the weeks and the months are blurring because of this typical patterns of our lives are disrupted. We can put some order, some structure back in to recreate those balances and give us that meaning and give us that sense of order in an otherwise disorderly and seemingly confused and uncontrolled world. So, you know, again, these are some of the guided conversations I have with my staff, that we're working with our members to focus on some of these activities. And I think, you know, all of us probably have some additional resources that we use personally or know of that we could plug into each of these 10 things, in part that come out of, you know, some of the tool sets that are on those websites and those organizations which Kathleen went through. NAMI has great things about, you know, meditation, about, you know, different types of activities and exercise that people can do. You know, thinking about the things that are disruptors of our sleep and how do we, you know, if all we're getting is screen time now, our brains are being stimulated differently than they were before. And that can be hard for some of us to shut off and turn down. You know, realizing that, you know, if we start to feel that, if we are having a harder time falling asleep or staying asleep, that's a change you can lean into, you know, using guided meditation, using other auditory cues to help, or, you know, sensory things like aromatherapy to kind of help, you know, recreate, you know, some different patterns to help you break up, you know, where you've seen your routine changed. So, but again, I'm eternally grateful for, you know, both my friendship and partnership with Kathleen as we've worked on, you know, getting together some resources, you know, here during COVID in combination with Rotary, you know, supporting our mental health community, and helping me to reflect and recognize more both my need and the need that I need to serve for the folks and that I serve on my job and I serve in my community, and my club. So thank you all very much.
Thank you.
I'll go over to the chat real quick.
Let's see, what can our club do to help with the mental health issue in Hawaii? Any ideas on projects we can focus on? Oh, I love that one. You want me to start with that? I'll give you an example of what's happened already. Many of you can answer this too, because I know, at least for me, I've been able to call you. I'm actually a real planner. I like the idea of setting a calendar up and setting up projects way in advance and being super organized with your budget, blah, blah, blah. But you know what? COVID-19 kind of went poof with all of that. And so luckily, I've been able to call some of you directly and just say, you know what, we need this. And you have responded within, you know, hours. I know that's not ideal. That's not really what you want to have happen, but it has been amazing. Let me just throw out a couple examples, and I bet you have that in your community too. So one example is partnering with some of these agencies or just doing it yourself. You've seen all the, oh, it's so inspiring. Some of the partnerships with the food banks where people are giving food, and we are back down to the basics. Does our community members, our neighbors and friends, do they have food? Do they have water? Do they have a bed to be in? So actually looking around and coming up with a way to provide those sorts of activities, that's a great community service project. Recently, I was able to call a couple of you, and the new quarantine center that just had to put up 26 apartment units needed entertainment kits because they wanted to make sure people will stay in their units, because of course people that are homeless, like many of us, would want to get out. And so a way to keep them entertained, which, that was a unique shopping spree, you know? Let's go out and get puzzles and game books and all kinds of stuff. But you were like there. So that's a neat community service project. Some of you recently, you're already looking at who in your community, your Rotary community, is on a board of a nonprofit and checking in with them. How are you? Are you okay? Do you have a need? And what can the Rotary Club to do that? Is there to do that? I know the E-Club, so my club made some hygiene kits for the outreach workers that are out there right now, cleaning wounds and talking to people about, would you please consider a shelter? Some of the folks that are homeless are taking over the streets because everybody else is gone, but there they are. So they're really evident. So our community will let us know what we need. And I just love that Rotary is right there to fill that need. So those are a few ideas for Rick, who was on the chat.
Kathleen, I think one of the things, the question was on mental health. You know, what are some projects for mental health? You know, are you able to go into the schools and work with the kids on suicide prevention or something?
Oh, okay. I guess I saw all those things as helping with mental health too. But yeah, for me, that's all mental health related. Yes, you could go into the schools. That's a little more complicated. You have to do a little more coordination with, if you're going to go in and talk about mental health, that's a lot more complicated. You can't just start talking about mental health.
Yeah, this is Clarence
Yeah.
at our Savior. Yeah,
Aloha.
we you know, all the private schools are online, so yeah, just going in, that's not going to be feasible yet. But one of the issues that we've come across as administrators is there is that 30-day cycle going on where the kids are real happy. Yay, we don't have to go to school. But now we are seeing a mental breakdown with the students. They can't seem to grasp what the teachers were just teaching the week before. There's something going on. And also with the teachers themselves, the stress of doing all this stuff online, and they're away from the kids. And we have Polynesian culture. I'm part of that. We're very touchy, feely, physical kind of people, and we're stopped from doing that. So all this is, you're right, this is a great thing to focus on, the mental health, coming from that angle. What we're doing at our school, we're taking a mental health day next Friday, and we're doing a drive-by parade. And we got the idea from Campbell High School. You know, they're doing that drive-by. And we saw the community coming out to help and celebrate that. And then we're looking at this as a historical marker for this generation to project them into, give them a right trajectory into the future, like 9/11 did to that generation. You know, this one too. So keep it all positive, looking forward, but we noticed that there is a cycle of mental health going through. We had to re-inject intentionally and do something fun, different, and just to get them back. We only got a few more weeks of school, and then we're going into the summer session, and it looks like that's all going to be online again, public and private. So it's an interesting area that we haven't thought about, was mental health of our kids because of the online and because of the social separation.
Wow, Clarence.
Any thoughts on that?
Yeah, Clarence, that's awesome. That's awesome. Everybody here could do that, you know, have a mental health day and do something like what you're talking about. That's wonderful. At a school, at the community center, mental health day.
And then we're looking at, in our IA community, of seeing after this is all over, there should be a special parade to commemorate this coronavirus, just for our community's sake. Because we do have a lot of essential workers that live in our area. We got Polymomy and commuters, and so we're trying to see as a community what we could do. But it looks like just the fastest way is just try and get a parade together or something.
Oh, that would be great. Please invite us all.
On the other side of this, on the other side.
Yeah, yeah.
Lynn Goya has her hand up.
Okay. Hi, I'm not sure how to change my screen so you can see me, but one of the things that, excuse me, I've noticed with my youth patients who I'm doing telehealth with is that they're so isolated that they're getting depressed. So the lack of social interaction is really, really affecting them. And it's a really huge concern to me, so that I'm really trying to think of ways to facilitate small groups where I can have my patients do some recreational and therapeutic activities together. Excuse me. But I think if Rotary clubs could think of ways to bring youth together during this time and do all the social distancing and of course take all the precautions, but really work on giving them the opportunity to socialize with other kids their age, because that's what they really, really need right now. You know, the educational piece, I mean, it has its, I don't know how effective the educational piece is at this time. I think it varies with all the different schools, but there is no social piece to it. And I think it's hard for even parents to think or to realize that that's a really important component of their child's life that they are really lacking right now. So if there's any ideas that Rotary clubs can think of that can facilitate social groups, some kind of recreation, like a group outdoor activity that they could do together. I think that would just be great.
Thank you. It's awesome.
Well,
okay.
Well, I think we have a pretty long chat string that we'll get disaggregated with some additional ideas. This is, again, I think the best part, the very, very best part of this newly remodeled spring training is, I'm getting to see people that I wouldn't get to see that aren't, from, Oahu, aren't from my hui here, getting to have more ideas, talk bigger story, learn about more ideas. And so I hope this is just a generative conversation for work ahead, collaborations ahead, and conversations moving forward. So on behalf of Kathleen and myself, thank you all for spending the time with us today. Have a safe and blessed rest of your weekend. Mahalo.
Thank you so much.
This is great.
Aloha.
Thank you.
Thank
Aloha.
you.
Thank you.
Thank you.
Thank you, everybody.
Nice to see everybody, even though I couldn't be seen.
Good job, Kelly.
Thank you all.
Thank you.
My exit button.
All right.
Okay.
How do I get out of here? I can't get out. Right. Is that where I get out?
Welcome to the Hotel California.
Oh,
I cannot get out.
Okay, before I close, I want to make sure I got the text captured. So thank you guys. Thank you, everybody.
Kelly, send me the PowerPoint, and I have the chat, so I can send you the chat too, because the chat is actually from 9 o'clock. So I can carve out the ones for today, because there were several people who offered to be speakers, so we can post that on the speaker bureau list.
Oh, sweet.
Yeah, and Bridget, you talked about a Hawaiian retreat.
Yes.
So what if, because we've been having these talent shows, and the one on Friday is going to be a family fun day. What if we have one as the Hawaiian retreat, and so Susan Salvo can talk about what did she do? Aromatherapy, and then somebody could talk. You could talk about self-hypnosis, and some fun things to do for keeping everybody mentally engaged. I don't know what you call it, but
yeah, absolutely. And I mean, I'd love to develop that with you, because it's my passion to try and be able to have that kind of outreach to bring people together, to teach them the science